Good morning, everyone. We are not out of the woods, but so far, so good. I'll run through what we know this morning, including the results we've gotten back so far and the contact tracing work. But I just want to caution that we still need to get a lot more results back today, and we still need to get a lot more testing today, especially the Catherine contacts. One of the reasons for that is we want to make sure that test results are accurate results, and today is the day for that. This means we're not going to have a better picture of how we are going until late tonight at the earliest, but much more likely tomorrow morning. But I'll go through everything we do know now. First, the most important news, there have been no new cases of COVID-19 recorded in the Territory overnight. There were 1,846 tests done yesterday, all negative. There was one very important test done yesterday. We retested the positive case and confirmed that he is positive. His second test was more infectious than his first. That means we detected the infection early. It also indicates that he was more infectious in Catherine than he was in Darwin. So that's why the Catherine testing is so important today. We have some other important results through, but other important ones are still pending. The friend that the positive case spent time with in Catherine has tested negative. He will stay in quarantine for 14 days. The taxi driver from Thursday night has been transferred to the Centre for National Resilience, and he has also returned a negative test result. As a close contact, he will stay in quarantine for 14 days. The driver did not take any other fares that evening, and the taxi was not used again until 9 the next morning. For the Uber driver, also a close contact, he has been transferred to Howard Springs. We got his test result back just a couple of minutes ago. It's also negative. He continued to work for 3 hours on Friday following his contact with the positive case. We now have his customer data from Uber. There are 10 people who we are classifying as close contacts. Our contact tracers are tracking them down now. I'll run through the exposure sites now. There were 32 people on the man's flight from Sydney to Darwin via Canberra. 25 are still in the Territory and are being isolated and tested. 6 have since gone interstate, and we are informing those jurisdictions, and we have 1 person that we are still tracking down. To the Hilton Hotel, 11 people are classified as close contacts. The man stayed on 2 different floors during his stay at the Hilton, and all guests on both floors are being treated as casual contacts, so they will stay isolated until a negative test result comes back. For the Outback Steakhouse, 12 people are close contacts. 3 have since gone to WA. We have contacted WA authorities about that. For Salvatore's, 7 close contacts have been identified and isolated. We have also identified 2 close contacts from his time at the testing clinic on Sunday. Both are isolating. For the Minimart and the Darwin CBD, there are 8 close contacts across the 2 visits. We are still trying to make contact with 4 of those people. For Knott's Crossing Resort, 13 close contacts have been identified. 11 are in isolation and 2 are interstate. Because of the risk level, all 11 still in the Territory will be transferred to Howard Springs today and will be tested on arrival. For the Woolies in Catherine, we just have 1 close contact at this stage at the Woolies, but we're between 200 and 250 casual contacts, and we're working as quickly as possible to get those people isolated and tested. We've updated the casual contact exposure sites on the website, so I urge everyone to keep checking the coronavirus website to see if it applies to you. We now have a time for the Smith Street Mall exposure site. If you were in the mall between 5:30 p.m. and 6 p.m. on Friday, you are a casual contact and required to isolate and get tested. In particular, the Westpac ATM in the mall between 5:40 p.m. and 5:45 p.m. on Friday is also a casual contact site. We have now included a store that sells gifts in the shopping centre in Catherine, where the Woolies is located, as a casual contact site between 1:10 p.m. and 1:20 p.m. on Sunday. I'll just sum up what we know about our close contacts. There have been 99 people identified across the exposure sites. 32 are in Howard Springs or are being transferred there. 41 are in other appropriate forms of isolation. 11 have travelled interstate, and those authorities have been notified. 15 close contacts remain unaccounted for, and 10 of those are the ones from Uber that we've just identified. So what does all of this mean? Basically, it means we're now in a waiting game. We believe we've done everything we can to trap the virus. We just need to wait and see what the outstanding tests come back as. The wastewater from Darwin is being tested today, and we will get those results back late tomorrow. The Catherine wastewater is also being collected today. Normally, we wouldn't get those results back until Thursday night, but we're pursuing every possibility to get those results back sooner, and I'm confident we can do that. We will keep tracing the handful of people we haven't tracked down yet. And just on that, on the contact tracing efforts, the team are doing an incredible job. They work as fast as they can. and I cannot overstate how much easier the Territory Check-In app makes their job. To give you an idea of what they do, I'll use the Woolies in Katherine as an example. We've identified 207 people from the Check-In app, but by reviewing CCTV footage, we know there are around 20 or 30 people plus who did not check in. That means our team has to cross-reference people's faces on CCTV against the list of names we have, then work out the faces we don't have names for, then we have to find them. It is incredibly painstaking, it is complex, it is time-consuming, and that is what they have done. They only have 1 or 2 people left to find. Every time you check in with the app, you are making the contact tracers' job easier and the lockdown shorter. Every time someone chooses not to check in, you are adding hours to our clock. The check-in compliance has been good, but it has not been great. It needs to be great. Check in every bloody time, just check in, check in. There is absolutely no excuse whatsoever for not doing it. It's the easiest thing in the world. Take your phone out of your pocket, scan the barcode. Now, it is up to businesses to ensure compliance too, but they do have a lot on their plate. So please don't make their job any harder. Just check in, it's easy to do. Please help out our contact tracers and check in. Finally, we have not yet determined the source of the infection. So right now, while we're in the middle of the lockdown, I'm not going to speculate on where it came from or what it means for our border protection and quarantine policy in the future. After our last lockdown, we did add an extra measure, a day 3 test for anyone who had recently exited hotel quarantine. It was purely as an extra precaution. Thank God we did. If we hadn't done that, this gentleman would have been working in the Territory, spreading COVID, and we would have had no idea. He was asymptomatic. There is no instruction manual or top drawer for beating COVID. We are always learning and always improving our systems in response to new threats, and we will keep doing that. We will keep doing whatever it takes to keep the Territory's title as the safest place in the nation from the coronavirus. It is a team effort, and I thank every Territorian out there for what you've done over the last 18 months to keep us where we are. We will keep doing everything we can right now through this lockdown to make sure you stay safe. Thank you very much.
Thanks, Chief Minister. That's a lot to take in, and I can speak to some of the detail on this. Most importantly, though, I want to show appreciation to a number of people, particularly contact tracers and police assisting them with CCTV analysis overnight, and our laboratory. I think that's been spectacular, and fortunately also thank you to the community for only going to have a test at the moment unless you're a close contact, a casual contact, or got symptoms. That makes it much easier to do the analysis. I do want to acknowledge also the behaviours of the community and the visitors here. That's been spectacular. As far as we can see, people have been complying with the requirements for mask wearing, not going out unless for essential goods or services. I encourage you to continue doing this. The use of the QR code absolutely is essential, because if you don't do some form of check-in, and if you haven't got a phone that can do that, each premises and business will have a place where you can write your name and contact details. This is really important because you could be, without doing that, walking around for a time whilst infectious, and we believe this is likely to be the Delta variant. The genomic testing will have results later today, and we'll cross-reference that with our colleagues in New South Wales. And we can see again the dreadful harm and indeed death of people in New South Wales because of this variant. The Uber driver, but his vehicle, again, another example of how this particular variant of concern can spread from contact with surfaces such as seats and door handles. So this is a really important principle that all of us have to be aware in our behaviours, our personal behaviours. Can I speak to people in remote locations, Aboriginal people or non-Aboriginal people, that the wearing of masks is strongly encouraged, especially if you have been into either Darwin or to Katherine. And now we understand, because of the CT value it's called, that the person was most infectious whilst in Katherine. The wearing of masks is now a very important part of our behaviours. Also, not mixing, not mingling, and preferably not gathering in large gatherings at all, even outside of the lockdown area. I would just strongly encourage people when they're thinking about those activities. I also want to really thank the index case. Had he not done that day 17 or day 3 test, it is, we would not have known. As the Chief Minister said, he would have been walking around unknowingly that infecting others. But this is going to be the reason why we have this current lockdown, and it may need to be extended if we haven't got all of the information required, where people can move more freely. But that's not to say that there won't be, as we did with our first outbreak, where there were still some controls in place afterwards. So thank you for everybody's cooperation. Really important to understand so far what we see is looking good, but there's a way to go because, of course, the contacts, close contacts particularly, they've had one test. We do have to wait and see if their subsequent tests are negative. I think I want to also restate that there's still no evidence where the index case acquired his infection from. We get some information, there's some clarification with colleagues in New South Wales overnight, and we'll investigate that further. And it may have been on an aircraft or an airport. That's yet to be determined. And these days, again, travelling anywhere is fraught with risk, not just a risk of getting caught by a lockdown, but the risk of actually catching COVID-19 and its dire effects on the persons or their relatives. Thank you.
Good morning, everybody. We've had our lockdown posture in place now, and we've got the relevant road border checkpoints in place as well, and that's been working relatively well. We saw a surge on those particular areas up front. We've been doing a fair bit of communication with people at those checkpoints. Those people are in the lockdown area in Darwin that normally reside in Katherine. We've been allowing to travel directly to Katherine and vice versa, those in the lockdown area back into Darwin who've got a residential address up here. We've facilitated that as well, but the clear direction is not to stop at Adelaide River, Pine Creek or any other roadhouses in between. To date, the compliance has been generally pretty good, but there's a number of key areas that I want to point to. First and foremost, when we talk to you about not having to surge at supermarkets, we're not wasting our breath here. We're telling you that those supermarkets and those essential suppliers remain open to you. When we're going into a lockdown, our intent is for you not to associate with as many people. So in the cold light of day today, we now don't need to surge to the supermarkets, and they're still open. If you were one of those people that surged to the supermarkets yesterday, please take time to pause and reflect, because you may have placed yourself at risk if we didn't act as quickly as we did. So please, for any future lockdown developments, have sufficient supplies on hand and know that those supermarkets are open to ensure you go. The important thing to follow, though, is the whole family does not need to go. The whole household does not need to go. Please identify a single individual to be the person that will go to the store to get your supplies. As I restate, in the cold light of day, just reflect on your behaviour and see how you could have contributed far better to ensure our intent is achieved by keeping all Territorians safe and mitigating the spread of COVID. To those people who are living just outside of the lockdown areas that rely on many of those supermarkets, similarly, please do not travel in with the whole station, all of the employees. Please send one person or two at a maximum to go and undertake the supply. That's the imperative that we need. We want to minimise the movement, and you can help us to help the community by doing that. Our flights are continuing to come in. Our road border checkpoints from other hotspots continue to be in place. We must remember that there is all sorts of activity continuing to occur across the Northern Territory, and our response to COVID is not just to our lockdown areas, albeit that our lockdown areas we have surged immediately. I've moved detectives in to support the CDC for the contact tracing. We've surged detectives down to Katherine to make sure that we're on the ground working with the relevant locations there to make sure that we can review the CCTV as quickly as possible to get those relevant people tested. That is an imperative for us. The Emergency Operations Centre with all represented agencies have been going full noise and working 24 hours a day to get on top of all of this for us. I'm pleased to say that the current advice is it looks like we will be able to get the Katherine wastewater testing down to Adelaide and bring that timing forward of the test result. There's a number of moving parts still in that, but our intent is that we will hopefully have that result prior to midday on Thursday so we can make an informed decision as to what the lockdown posture may look like. So we are working as hard as we reasonably can with the available resources we have to get that information to you and have a consolidated point of where we stand. There is much to do. Whilst the results at the moment are encouraging, it's important to note that there are still many, many tests outstanding, and we will get more information through the course of the next 24 hours. So please do not become complacent. Unfortunately, overnight, 4 offenders were located breaking into a restaurant around the East Point area. I've confirmed that those individuals were not wearing masks. They will be receiving the $5,000 fines as part of the charges that will be going before them. So that's over $20,000 for those 4 people who have broken into a business that already is being impacted by lockdown. Crime is something that unfortunately will continue, but my team are critically aware we will be adding the $5,000 to any charges that we find where you've committed offences and we can prove you weren't wearing a mask during that. Now, that's not to say I'm encouraging crime to occur, but I'm reinforcing the fact everyone must wear a mask when you're out and about. That is a key priority. But please, do not target businesses who are already under the pump because of the lockdowns that are going in place. In fact, go the other way. To those of you that can, please support those industries to make sure that they stay afloat. And again, all do your bit by wearing your masks, doing the right thing to make sure that we can get the lockdown lifted as soon as reasonably possible.
Commissioner, last lockdown you took an education first approach. This time are you stressing more compliance and handing out infringements?
So certainly we've made that message very clear yesterday that we want to move into compliance far quicker for those that we know that we've already previously engaged with. Katherine, we understand this is the first lockdown for Katherine, so we're being more focused on education through that pathway. But for people in Darwin and residents in the Greater Darwin area, this is not your first dance. You've been through this before, you know what's expected, and encouragingly to date we're seeing pretty good levels of compliance. Our hotline has received a number of calls as it relates to businesses that are trading that are probably pushing the boundaries as it relates to being essential, and I've got officers through our Operation Crown team visiting them today to make sure that they're understanding the show directions, and if they're in breach of that, we'll ask them to close. If they continue to trade post that, we'll move into compliance.
You asked those people to reflect on their behaviour, their own behaviour, those people who rushed the supermarkets yesterday. How would you reflect on their behaviour?
On their behaviour? Well, again, the message is very clear, and I don't know how many more times we have to demonstrate it. Those supermarkets stay open. So you can go there at 8 o'clock in the evening after the lockdown comes into effect at midday. You don't need to surge there that day. There are many, many restaurants and other takeaways that can still provide food to you. So you can still get lunch, you can still get dinner, you can still get breakfast. So you can access food, and many of you have the means to be able to do that. And certainly the images we saw of many of the supermarkets are people that clearly have the means to be able to provide food and access those additional services while supporting industry. It's really, really clear. We are keeping those essential services open for you. So the midday lockdown is actually for your behaviour. It's for you to get home. If you're non-essential, get home, stay home, and then send a single individual from your household to the supermarket to get appropriate stores later in the day.
Would it be worth sending more police officers to supermarkets to crack down on that sort of panic buying behaviour?
Well, that's something that we can certainly look at, but what I'm basically saying to the community is help us to help you. Don't make that a problem for me where I've got to send my finite police resources there. We've already got additional lockdown areas in place with border checkpoints. We've got ongoing border checkpoints out in some of the most remote parts of this country. So do yourself a favour, if you're truly committed to the Northern Territory and want to help us out, just do the right thing.
Chief Minister, questions? Obviously, businesses are hurting big time at the moment, going through 3 days of lockdown. What interactions have you had with the federal government about potential for federal support? Are you expecting NT to be declared as a Commonwealth hotspot under the current one case that we've got here?
Yeah. I've spoken to Josh personally again this morning, and we're working together about what we might be able to do in the Territory. We're working on a package prior to us making this lockdown decision. There is a recognition from the Commonwealth that areas outside of lockdown areas were hurting, so there was already a general recognition that we needed to do something, and we were quite well advanced on that line of conversation. We've now obviously had our own lockdown, so we are working together with the Commonwealth quite positively about that's something we'll be able to do. I flagged that yesterday. I can't give you details yet, but we're working further with Josh today. I'll pass to Dr. Heggie, because Dr. Heggie's been talking to Dr. Kelly about the Commonwealth declaring us as a hotspot under their definition. There's just a couple of bits of information that Dr. Kelly wants, like the genomics. So I'll just pass to Dr. Heggie to comment briefly on us being a Commonwealth declared hotspot. Sorry.
Again, another really important principle is that it's not just about the health of people, but also the health of our economy, and all that is that we've done here in the Northern Territory. We've had, I guess, the leisure of having a lot of businesses and premises open and activities. I did speak with Dr. Kelly yesterday and this morning, and there's just a couple of pieces of information, one which we already have, and that's the repeat testing to confirm that the index case is positive, and we've got some other results coming later today, which is serology. That's the antibodies that are in the blood in response to a viral infection. So this is a really useful partnership. Importantly also, that we have a territory-wide aged care public health order, direction as we call it, that limits the movement into and out of aged care facilities for the period of the lockdown.
So Dr. Heggie, under the current scenario where there's one confirmed case, is it your understanding that the Commonwealth would consider declaring these regions here as a Commonwealth hotspot?
It is my understanding, as was said by the Chief Minister, that it is likely, not confirmed, that they would support this. Correct.
Thank you. Can I ask you, and maybe also the Chief, given that one of the considerations here, or one of the scenarios that you're looking at, is that this person, the index case, got COVID potentially after leaving quarantine, potentially in an airport, potentially on the plane.
Yeah.
Is it a good policy at the moment then to allow or to not declare airports as COVID hotspots in places like Canberra and in Sydney?
Again, really good question. We, along with other Australians, but particularly Territorians, travel a lot by air. There is a real risk, there's no doubt about that, but the control or hotspot declaration of an airport is problematic, because there'll be a whole lot of things that won't happen. Essential workers, the neurosurgeon, as I mentioned yesterday, would not be able to travel through an airport that was declared. So I think this is an important question. I think more is the principle that when you go to an airport, that you do comply with all of the requirements, keeping your mask on unless you're eating or drinking. This is really important. Also, it's principles like hand hygiene. People who wear a mask must be also reminded it's not just the wearing of the mask, but it's actually the taking off of the mask, potentially if you've been in contact with someone with COVID-19 through spread. You can actually contaminate yourself by touching your eyes or inadvertently touching your mouth after it's off. Thank you.
Chief, Do we know if the index case, given he travelled from overseas, do we know if he'd been vaccinated?
The index case has been extremely cooperative, apart from on one question. He won't divulge his vaccination status. So we have to operate as if he is unvaccinated. He may be vaccinated, but he won't tell us his vaccination status.
Explain that.
I don't know why he won't tell us his vaccination status. Has he given a reason for why he won't?
I think one might presume that he's...
Do you want this at the microphone? Sorry. Do you want...
Yeah.
We have to operate under the presumption that the index case is actually vaccinated, but he's a US citizen and he's declined to give that information, and we respect that. I guess from travel overseas, what is required at the moment is actually people have to have a negative test before they leave their country of departure or place of departure, and that is required, and the Commonwealth Government require that, and AHPPC supports that.
Chief Minister, just on the vaccination issue, in WA, the Premier there says that people coming in from hotspots like Sydney will now need to show that they've had a first dose or a test before coming to the NT. Is that something you're considering here, given that this person has arrived, gone into international hotel quarantine in Sydney and come here? Would you consider introducing a mandate like that as got in WA?
I think it's important to keep adapting as the virus does, and so we'll review our border policies at the end of this lockdown. I think knowing how he caught it will be important. We don't know that yet, and hopefully genomic testing later today will inform us of that. This is a conversation we're having both at a territory level and at a national level about how we might further handle movement between borders. But I think at this stage, I'd suggest it's more an open question for us. My priority at the moment is getting these test results back and determining what's happening within the territory. We'll obviously review our border policies post that, but I don't want to speculate.
Is that one of these scenarios under consideration?
The difficulty is, and the Cho or the Commission might be able to answer this, is the ability to which we can mandate the provision of some of this information for us to be able to handle our borders. So obviously WA's made their decision. We've got to review the information we can definitely demand of someone and then how we act on the back of it. It's just an open question for us at the moment. I don't want to speculate.
And also previously, if you flew in from overseas, you'd have to undertake 2 weeks of quarantine in a place like Sydney if you arrived there. Then you would come to the territory and you'd have to undertake another 2 weeks of quarantine here. So it would be 4 weeks all up. Why is that not in place anymore?
I don't recall that. What we have always said is, if you're coming from overseas, that's obviously where the riskiest spot is. You have to do 2 weeks quarantine. He has done 2 weeks quarantine and he returned a negative test in his quarantine. I think we should be really clear. There is no evidence he actually caught it in his quarantine facility at this stage. So we need to know where he caught it from. And once we know that, we'll be able to make a decision. If he had been from the hotspot, we would have demanded 2 weeks quarantine here, but he exited his hotel quarantine and he went through the airport. He travelled in an approved manner. It is concerning about how he might have caught this. And I think it's critical I don't speculate or make policy yet until I know how he caught this, but it will have a potential impact both at the territory and national level if he developed it, obviously, caught it in an airport.
Can I just ask you as well about the three-day policy?
Yes.
Sorry, just one more. About the 3-day policy, after 2 weeks of quarantine, then you have to do a 3-day test. There's a lot of questions about why this person was able to move around the territory during that time that he was waiting for the test result. Is that another thing you're considering, whether or not someone has to remain in place until they get the outcome of the result?
I think I can answer that, and I'll ask Dr. Heggie to add to it, and then there was some questions over here, so I'll come to that. We have our policy essentially out of an abundance of caution. This gentleman had done 14 days in quarantine and returned a negative test in quarantine. We ask people who are close contacts or symptomatic to isolate. He was neither a close contact or symptomatic. We simply asked him to be tested because he spent 14 days in quarantine. So essentially it's from an abundance of caution. We have no clinical advice or evidence to say that we could deprive that person of his liberty, and that's a big thing that we do discuss at SEMSI and have discussed a lot over the last 18 months. The CHO direction has to stand up in a court. The police officer has to feel capable and comfortable of actually implementing it. So I'll pass to Dr. Heggie, because I want you to have the same clinical advice that I get. So 14 days in quarantine, returned a negative test, otherwise we wouldn't be allowed to leave quarantine. So therefore, based on all the clinical advice we have as a country, free to leave. He didn't enter the hotspot in Sydney. He went through the approved method of travel, and then in the NT, as essentially an extra layer of precaution, we demand of anyone who's exited quarantine essentially a day 3 test, and that's as a measure of caution. This individual was not symptomatic. If he'd been symptomatic, he'll be required to isolate, and he wasn't considered a close contact. And again, if he'd been in close contact, he'd be required to isolate. So in some respects, this is a over and above test that we do, and in this instance, we caught someone quite early, and thank God for that. But I'll pass to Dr. Heggie to add to that clinical advice, and then we'll come. I hope to come to that. Your question.
Thank you for the question, and I'll try and clarify some of the others. So it needs to be a proportionate approach. So in regard to the day 3 testing, it's 3 days after you've left quarantine, it is around 1 in 5,000 positive cases that will still be infectious beyond the 14 days. So if we actually restricted people, number one, to move around, there'd be a lot of people that would be restricted that were not going to be infectious at all. It is true, though, that with this variant it is more infectious and more virulent, and that's why we have to have extra precautions, which was described earlier. In regard to mandatory vaccination, there's some people who, because of their health conditions or medicines that they take, they can't be vaccinated. So that's an issue in itself. But I want to speak also to the extra 14 days. We've never had an extra 14 days unless you've come from a hotspot. It is true that there are some jurisdictions that have required this or are requiring this at this time. In regard to vaccination, though, the best protection is for Territorians, all of them, to get vaccinated yourself. And we actually have plentiful supplies and more supplies coming. You can book online or through a telephone number to make an appointment in remote locations. The health centre, irrespective of whether it's government funded or not, will work together to find the people that most need it and get everyone in that community, everyone vaccinated. So this is our main aim, is vaccination rather than vaccination of people who come here.
Can I just clarify, Dr. Heggie, is there virtually zero chance or 1 in 5,000 chance that the index case actually contracted the virus overseas? Is it far more likely that he's either contracted it in hotel quarantine or in an airport on the way here?
Well, that's what I said. It is possible, but unlikely, given that he had negative tests during his time in hotel quarantine. But the serology that will come later today will clarify that, and that can be shared next time that we meet.
And do you know which part of the United States he came from?
No, I'm not aware of that, and I don't know that it's entirely relevant because it could have been where he was living or where he travelled through.
Are we taking steps to try and get his vaccination information? What are we actually doing to...
Well, again, I think it was answered by the Chief Minister that we can request it, but he's reserved the right not to declare it. So it's somewhat, I'm going to say it's not relevant to this particular person because we know that you can be vaccinated but still catch the virus. And we've had people who locally have come back from overseas and that has happened to them. The most important thing about vaccination is that it will protect you from serious harm, and that's we're talking about prolonged recovery, months and months of fatigue, hospital admission, ICU admission, ventilation. that's pretty serious when you're on a ventilator, but also death. And my heart goes out to New South Wales at this time.
In regards to testing, like the Chief said, there were 1,500 tests in the past 24 hours. Is that enough for you, or do you want to see more?
It's more about who gets tested first. And again, I've got to thank people for not just rushing on and having a test because they're worried. It's the people who are close contacts and casual contacts that we would want tested. Doing broad-based community testing, not only does it take up a lot of man hours, it uses up a lot of human resources, but also laboratory reagents. And, you know, we have to get ours from other places. So thank you to the community for that. No, I think it's the right people who are being tested at the moment.
Chief, can I ask you a couple more questions? In terms of the sewage testing, it sounds like if the lockdown's to end, if you really need to get the results, certainly for Catherine, you need to get the results sooner rather than later, but I think it was mentioned by Dr. Heggie that you have to send the results down to Adelaide. Given we're 18 months into the pandemic, why does the Northern Territory not have any facilities to be able to test for sewage?
I might pass that to Dr. Heggie. In reviewing the Catherine wastewater testing process, there was some significant logistics involved. I think we can all acknowledge that none of us ever thought it'd be pleasant to test the wastewater, but it's certainly more complicated than I appreciated. But I'll have Dr. Heggie comment on that. The same obviously is true for the genomic testing, where we have acquired a machine that allows us to do it, but hasn't been accredited. So we have to send that away for results as well. I'll ask Dr. Heggie to comment on the wastewater process.
Thank you. To clarify, wastewater testing is for fragments of the virus. Secondly, it's a 24-hour collection. It's not just a sample of water. You might be interested to know that it's around $7,000 per test. We actually had wastewater testing here for our previous outbreak, and it was useful to guide us about where we didn't see any virus. And of course, we do see it in relation to where the quarantine facilities are. I think that there was preparation and importantly partnering with other organisations in terms of wastewater management in the Northern Territory comes under a whole range of organisations, not just the main one for our urban centres. Also, we did a collaboration with all of the other jurisdictions to share the information and expertise about this. So it is a tool, but it's not the most important tool. It's actually testing is the most important tool, and the best protection again is vaccination.
Last couple, please.
Chief, for us to get out of lockdown on Thursday, what do you need to see? Do we need to be at 0 cases with all close contacts and casual contacts return their tests as negative?
It goes to our test, trace, trap strategy. I need to have confidence that we have the virus trapped, and if we have that confidence, then we can lift the lockdown. The lockdown is essentially a very broad measure to contain the virus. If I've got confidence that we've got all our cases, at the moment it's one, but if we've got all our cases essentially, locked and linked, then I can lift with confidence. So that's what we need to know. Wastewater will be useful. We haven't used it much during the last 18 months, but it will be useful. But more importantly, will be those close contact tests.
Going forward, is that the situation will be in one case equals lockdown?
It goes to the nature of the case. For me, in this instance, it was the period of time, not just the case. And while it was a casual contact site, I personally am quite worried about the Woolies, casual in half an hour. So it goes to the nature of the case and how it presents, not just simply a case. I think that we always have to take the whole question in.
In relation to the Doherty Institute analysis, where you asked them to go back and look at the vaccination targets for the NT specifically, have you received that advice yet?
No, and just to confirm, that is something I've sought through the National Cabinet process. I made a decision of the National Cabinet, and that information is going to come back into the National Cabinet. It will be informative not just for the Territory. It's obviously extremely relevant in the Territory, but it'll also be relevant to significant parts of Western Australia, Queensland, top of SA, parts of New South Wales. So for me, it's very important for us to know as a nation how we handle the vaccination status in those communities where the whole of population versus eligible population has a different mix.
So is that coming back next Friday or
Last
next?
I don't have an exact date when Doherty's going to receive that. Sorry, I don't have an exact date when Doherty's going to give that information back to me, but if I can give you some confidence about what we need to know and when we need to know it. We know that we'll get the majority of our Pfizer supply and have confidence that we've essentially made a reasonable opportunity to get into arms probably by the end of October, and they'll give us then a chance to be able to genuinely see, are there areas of vaccine hesitancy in the territory? And that's either by remote community or other versions of subgroups, and then have a concentrated targeting of those areas. And so not necessarily a remote community, it might be a particular age group or particularly multicultural community, it could be anything. But we'll have confidence by the end of October if we've got areas of vaccine hesitancy. I'll also obviously know by then, well truly by then, what that Doherty modelling might be. So in some respects it is a race, but by the time I get through supply and those things, by the end of October, we'll have all the information we need to be able to make informed decisions.
Just in relation to the concerns that the Police Commissioner raised about the panic buying, would it make more sense to give a little bit more time between when you announce the lockdown and when the lockdown kicks in, rather than, I think yesterday it was announced at 10:30 and by 12 o'clock we were expected to be in lockdown?
No. You can go to shops after lockdown. There's a genuine reason for leaving the house. It's not an opportunity for an excursion, but you can leave the house after lockdown. I believe getting the lockdown in as soon as possible and restricting movement as soon as possible is critical to making sure we don't transmit the virus. I think yesterday I was pretty descriptive on my thoughts. Panic buying is stupid. The shops remain open. You can get what you need after lockdown is decided. Just look after yourself, look after your family. You can go out to the store later. The food or other things that you need will be there. We have a whole task force under the Emergency Operations Centre that is allocated to freight and food and logistics. We essentially do believe in the importance of supply. We'll make sure food and other things are supplied. You don't need to panic buy.
Thanks, everyone.